Okay, good evening everybody and welcome to this webinar on the NVPS. My name is Caroline Garvin and I'm currently head of the One Health, One Welfare Veterinary Medicines AMR division, which is responsible for the rollout of this system. And I'm just going to introduce to you my colleagues that are on the call here tonight. The purpose of this webinar is to explain to you in some detail how the NVPS operates, and hopefully it'll be useful, and we will take questions after the initial presentation. So on the call here as panelists, I have William Fitzgerald, who is an SVI in the Department of Agriculture. He was in charge of NVPS, if you like, but he has subsequently moved to a new role. But he's kindly joined us here this evening to answer any questions that people might have. We also have Rebecca Fitzpatrick. Rebecca is the new SVI in the AMR section of the division. So Rebecca is taking over William's role on the NVPS. We also have Cayman Maloney. Cayman works in the IT side of the Department of Agriculture, and he's here to offer his any information you might need on that side in terms of registering to use the system. And then the other two members on the panel are Helen McCreary and Gianpaolo Surani, and they are part of the IT development team externally employed by the department to develop this system. So we hope to get through a presentation and then we'll take questions. But really the purpose of this session is to give you as much information as possible, and then please ask as many questions as you feel are necessary after the presentations. So Rebecca, you might, if you don't mind, share your slides please first.
Sorry guys, just before we jump in, we've had one question. Are we supposed to be seeing someone, or is this only a listening webinar? So you should be able to see it. That person who asked that question, you should be able to see the presentation has popped up there now, and before us you should have been able to see the five panelists. But as a suggestion, yeah, perhaps maybe perhaps I would just maybe if you want to log back out and try and log back in again to see perhaps if that works.
We can see your screen, Rebecca?
Yeah, we can see it. Okay.
Great. Okay. Yes, thank you. Yeah, everyone should be able to see those slides now. That's the presentation we're going to work off first, and then we'll take the questions. So I'm going to start, and I'm going to kick off and give you an update on the legislation, I suppose, that has brought us to where we are now. And then Rebecca's going to talk through how to register to use the NVPS, in particular the free app, but also what you need to do if you already have practice software that you're using. And then Rebecca's also going to demonstrate the use of the free web app. So I suppose the background to this system, it comes from the new veterinary medicines legislation, and I suppose just to say this legislation has been, it's been a very significant change as to, I suppose, how we do business in the animal health and the veterinary medicines world. It came into force in January of 2022, so it's there now over 2 years, nearly 3 years, and the change in this legislation was it brought human health to the front and foremost, if you like, which wasn't really there in the previous veterinary medicines regulations. And the key emphasis was on better and more prudent use of antimicrobials. So it was really, I suppose, driving a focus on what vets do and the value that vets bring to protecting human health as well as animal health and welfare. So some key elements of this legislation would be certain requirements which would be seen as being restrictions around both preventative use, so use of antibiotics in the likelihood that there would be a disease problem, and also the use of antimicrobials or antibiotics for group treatment. So again, it's just looking at how antibiotics are being prescribed by the veterinary profession and how they're being used in animal health. And it is fair to say that, you know, it's not just the focus on the veterinary profession. Human health legislation is also very much looking at how doctors are prescribing antimicrobials, but the Commission has really focused first on the animal health sector, and this is because we have greater numbers of animals, they're heavier, so there would be more use of antimicrobials per population in the animal health sector. The other piece in this legislation is restrictions around antimicrobials that are critically important in human health. You will have heard us talk before about these highest priority, critically important antimicrobials. These are the drugs of last resort. When people go into hospital, these are the antibiotics that the doctors need to work in human patients. There are also families of antibiotics that are used in veterinary medicine. And so this legislation is looking to restrict use of certain categories of antibiotics. They have produced a list. Nothing on that list at the moment includes the fluoroquinolones, the cephalosporins that we have talked about and put controls around. But they have put other antibiotics on that list that can never be used in veterinary medicine. So next slide, please, Rebecca. So in terms of all member states have to bring in this legislation. So what we had to do, I suppose, was repeal the previous legislation. We had to make this new regulation applicable in national law. And then we also had to address some issues that possibly weren't specific for each country in the legislation. So next slide, please. So, as I mentioned, the two key pieces of legislation were 2019-6, 2019-4. They were implemented in 2022 by this SI 36 of 22. Then we followed on with the Act, which was written into law in July of 2023. So this kind of expanded on the European legislation. It updated medicines legislation. You may previously have been aware of the Animal Remedies Act. We talked about veterinary medicines as animal remedies. So this has been repealed, and we now have this modern Veterinary Medicinal Products, Medicated Feed and Fertilizer Regulation Act. And this is a piece of legislation that provided for the introduction of electronic prescribing, this national database, which is the NVPS. And this act also gave the minister certain powers to make other regulations that may become necessary. So next slide, please. So then in September of last year, we had the Veterinary Medicinal Products Regulation. And most of you will be aware there was an awful lot of discussion and debate around this piece of legislation through the Joint Oireachtas Committee and at government level. But that was signed in September, and then it followed on. That provided for the rollout of the NVPS. And then we had this second piece, which gave the date. The commencement order gave the date for when use of this electronic national database would be mandatory, and that date, as we know, is next Monday, the 13th of January. So what's in the veterinary medicines regulation? Just to give you a very quick overview, there are certain rules around prescribing of antiparasitics which are going to be upregulated. That is not going to happen until June. It also provides for this particular proper assessment protocol where there is routine, I suppose, expected preventative use of antiparasitics in certain scenarios. It provides for use of this proper assessment protocol, and it also provides for the development and rollout of the NVPS. Other changes in that legislation, just to briefly mention them, is the prescription validity. Since 2022, the prescription validity had changed to 5 days for all antimicrobials. So any prescription you've issued since January should only have had a 5-day validity. January 2022 should only have had a 5-day validity period for any antimicrobials, so antibiotics, antivirals, antifungals. But what this new piece of legislation last year, it moved the prescription period for all other veterinary medicines outside of antimicrobials. It reduced it down from 12 months to 6 months. The other thing that this legislation did was it required some additional details in your prescription. So you now have to have an actual prescription ID. Your VCI, your registration number with the Veterinary Council, has to be on the prescription, and also the marketing authorization number of the veterinary medicine that you're prescribing. That also now has to be on any prescription that you issue. And then, as I mentioned, the commencement order, that really set the date, the final date from when we were going to roll out mandatory use of this system, and that has been set as the 13th of January, so that's next Monday. And that is for food producing species only, which includes horses in that category. Thanks, Rebecca. So just to summarize up and look, understand this is a very, very significant change for the veterinary profession, also for people dispensing medicines, and for the end users, for the farmers. So I suppose just to kind of give some sense of why we're doing this and the aims of it, we do have a commitment to deliver, better directed policies that specifically protect public and animal health. Veterinary practitioners, the Department of Agriculture has a One Health role. So this means we have to protect not just animal health and welfare, but also public health and environmental health. And this system, through collecting the recording of the prescribing and use of antimicrobials, will give us that ability to better evaluate any policies and strategies that we have in place that serve to protect the human and animal health from antimicrobial resistance. As well as that, it really is important that we have this sort of oversight from a purely economic sustainability perspective, from a trade perspective. We constantly get questions on our use of antimicrobials because AMR is seen as such a key issue in food production and in food safety. And so we need to be able to demonstrate that we have these controls in place, that we have this oversight. So, in terms of securing market access to new markets and keeping the ones that we have, to enable ourselves to compete, we need to have this database. And it's fair to say, look, other countries such as in Denmark, they've been doing it for 20 years. The Scandinavian countries have been doing it for 10 or 15 years. All member states are developing these systems. Some are further ahead than us, very few are behind us, but it is just something that we simply have to have. Thanks, Rebecca. And then also, I suppose we do have a national digital strategy to move away from paper, that we move to this digitalization. And so this system is electronic. It feeds into that commitment. As I said, it will enable us to have oversight of prescribing, and use. So it will, improve those controls that we have in terms of food production and food safety. And as I've mentioned previously, it is a key action to protect human health against AMR. For yourselves, and look, fully accept that this is a time commitment. It's also a financial cost to you. How we convince you of the positives, I suppose one of them would be that it will allow you to be fully compliant with any prescriptions that you issue, and it will enhance your record keeping ability. For farmers, it certainly will give them choice around where they purchase their veterinary medicines, so it will maintain a competitive supply chain for them. And then finally, and as I've mentioned, we do have to collect this usage data because the regulation requires it, the European regulation requires it, and we have to submit data for 2023 for pigs, poultry and cattle. We didn't have any cattle data. And so, not every country had it either, but it's certainly the Commission has requested that for 2024 that we do have that data. And as we move forward, this is the space that we need to be in, that we have this usage data to send in on an annual basis. So I think that might be me, Rebecca. So look, that's just a quick background to the legislation and how we've got to where we are now. Rebecca's going to take over now and talk about registration. And just one thing I do want to emphasize is that there are two options in terms of how you interact with this NVPS, this national database. One is through the web app, or the other is through your practice software. So for anyone that already has practice software, it will need to be upgraded, and we have been engaging with software providers on this. But just to be clear, there are two options out there as to how you interact with this system. So I'm just going to hand over to Rebecca now, who's going to explain the whole the mechanism for registering if you want to use the web app, and she'll also talk about what needs to be done on the software side as well. So thank you, Rebecca.
Just before you start, Rebecca, very, very briefly, there's been a
Yep.
couple of queries in, and just suppose just a note for people to pop your questions in the questions box as opposed to the chat box. So into the questions box, please. And there was two questions about the event is this being recorded for later reviewing? The answer is yes, it is. We've had one person who has contacted us said due to the prevailing weather conditions that their internet feed is quite poor, and they were anxious to know whether or not there was a possibility of reviewing this afterwards, and the answer to that is yes, it will. Sorry, Rebecca, away you go.
No problem. Thanks, William. Thanks, Caroline. So I'm going to talk you through how to register for the NVPS application. So like Caroline has said, there are two ways to use the NVPS. So one is through this application, the free web application, or the second is through your service provider, your software provider. So in order to register for the NVPS application, users must first be registered as a customer with DAFM. So you need to be registered with the DAFM for online services before being granted access to the NVPS. There are two forms for registration. There's a company registration form, this CCM form. So this is for your company or your practice, and this just has to be sent in once per person. And then there's a form then for all practice staff who are intending to use the NVPS. So this is the SSO form. And both of these forms are they're available at the moment on the gov.ie National Veterinary Prescription System website. So if you go to gov.ie, NVPS, it'll be on the registration process there. These forms need to be sent back in then to the NVPS section back Western Campus. So you can either send it back in by post, or you can scan and email the forms back in to us to nvps@agriculture.gov.ie. And once registered then with DAFM Services, each user will receive two letters which will contain the username and the login details for the NVPS. So if you currently have access to AHCS, you're already registered with DAFM, and all you need to do is email your name and your AGR number to nvps@agriculture.gov.ie to request the NVPS app. And the admin team then will process your request and make the NVPS app visible on your list of applications, and you log into your account. And there's also a method then of downloading the application and saving it to your phone like you would a banking app or anything like that. If you use a software provider, you need to discuss with your software provider that they can submit data to the NVPS from the 13th of January, so next Monday. So you don't need to register to use the NVPS application separately if you're solely using your software provider, but it is an option that you can use both. So you can register to use the application and obviously use your software provider as well. So just to summarize, just the veterinary practice, the company need to have a CCM form filled out and just returned to us by either post or email. So if you know a colleague has sent this back in already, you don't need to send this in. If you're a vet and you're using AHCS, you just need to email your name and your AGR number and request access to the NVPS. If you're not using AHCS, an SSO form needs to be filled out and returned by post or email, and then just ensure then that a CCM form has been sent in for the practice. And the same then for veterinary nurses and veterinary administration staff. You just need to ensure that an SSO form is filled out for every staff member that's going to be using the NVPS. So the contact address then as well, or if you need to contact the NVPS team at all, it's nvps@agriculture.gov.ie. So just in relation to the application itself, I'm just going to run through a demo on the system. So just, I suppose, prior to this, just if you're using third-party API, so it'll vary then depending on the system that you're using, and each API or software development system may interact slightly differently with the NVPS. So there is a standard level that's required across all software vendors. Things you can do to try and help your software vendor prior to this is just to make sure you've clean customer lists in practice, just to make sure that herd numbers are correct, that contact details are okay. Download the clean price lists for the NVPS or the VPA numbers, and your vet details will be required as well. So just to ensure that they have your VCI registration number, and just ensure the practice email addresses, phone numbers, COSs, etc. are all up to date. So separate to this, and back to the web application. So the web application is free to use on any smart device. It's live and ready to use now, and is capable of integration with existing practice management software. And it can be used then for the creation or dispensing of vet medicinal products and medication feed prescriptions for all food producing species, including horses. So the NVPS application, it has a couple of apps within it. There's an offline mode, All drugs will be listed and their withdrawals listed. There's a favourite procedures function that you can use. There's hidden notes, a recording function for batch numbers. So it's not required for the script, but just required for your own records. And there's ongoing work in the background then to try and integrate this system with AIM. So I'm just going to log off the slideshow and just flick over then into the app. So I'm just going to log on just to do the NVPS application. Then you'll be in your home screen. And so there'll be a couple of options in your home screen. There's a prescribing section. You can see your prescription histories. There's a My NVS section. So when you log onto this homepage for the first time, you just need to go into your My NVPS and you can just update your VCI number and make sure your VCI number is in there. You can also then log into the offline system, or just to enable you to use the offline system, you can set up a PIN to use that. And what I'm going to do now then is I'm just going to go into the prescribing function, so I can go in then to prescribe a VMP. So when you go in, then you have a herd identifier. So there's firstly by animal type. So we've all the animal types you're going to be prescribing for on this page, and I'm just going to go into cattle. And then you can search them by herd number or keeper name. So when you click on this, then if there are farm or animal keepers associated with your practice, they will all be listed here. So when you are setting up this, your veterinary admin team can try and associate animal keepers with your practice. So what happens then is that the animal keeper will get a text message, say, are they happy to have to be associated with their practice, and they can reply yes or no. And if they are happy, then their details will come up here then under the herd number, which will save you a huge amount of time, obviously, filling out those details.
Sorry,
If you have a keeper, yeah.
Rebecca, just very quickly, can you enlarge the screen ever so slightly?
Oh yeah, sorry. Yeah, I will indeed. Is that any better, William?
Yeah, just it's been put in the queries in the column just about
sorry. I can
screen.
try.
So clear, there we go.
So if a keeper chooses not to be associated, or if you're going out to dispense or prescribe for someone that's not associated with their practice, you do have the option then to enter their details manually when you're there. But if you have an animal keeper that's associated, you can click, if this is the one that you're going out to prescribe for, you can click into their details there. All of their details will come up then on your page. And you do have the option to edit their contact number or their email address when you're out on site or out on a visit. So this won't change the details permanently, but just for this prescription, you can change it. If you're happy with all of those details, you click on to next, and then you go into the category of animals. So for cattle, we have beef and dairy, and I'm going to put through then for, if I choose dairy. And then you can choose here then to identify the animals that you're going to prescribe for. So you have two options. One is to individual animals, or otherwise, if you have a group of 5 or more animals that you're going to treat, you can go into add group ID. So if I just put through one for each then, so if I'm going to add an individual animal, you want to put down an identifier for that animal. And the same then for your group treatment. If I'm going to add a group, I need to put down the amount of animals that I'm going to treat for. So if I put down 10 in this, and then I can just say March-born calves. And I go to the next page. So here then I'm going to look up my VMPs. So for the individual animal, if I'm giving her mastitis treatment, I'm going to put, if I put through Finidine, so this is a smart search box as well. So as you're pushing in your letters there, it'll come up here. So the more detail you can push up here, then it will just narrow down your search. And I can select that. And then you can say which animal you want to use this medication for. So I want to use it for the individual cow. And then I'm going to administer and dispense this. I'm going to put down, if I give it 10 mils. And then my batch number here. And then I can click onto the next screen. The route of admins are going to be pre-populated here, so you can select which one you're going to use, and have I administered all products. I'm going to say yes. You have then a couple of little boxes here, so you can push in warnings and advice if there are any that you want to give to the animal keeper. You have this box here, then your vet notes box. So this is one if you have any notes that you want to write down for yourself or diagnosis, justification. This box here doesn't show up on the prescription, so it's just for your own records. The withdrawal periods then are listed here, and they're pre-populated, although they can change if you need to change them for any reason. And the same then with the withdrawal notes. And I go into next. There's a regulatory question, so I'm not using this as part of the cascade, and depending on the medication that you're going to be prescribing, there can be up to 3 questions here. And that's that product then there. So I'm going to add another product. So this I'm going to put through then just some tubes. So if I put through then Terexine, select here again for the individual cow. I'm going to prescribe the product and I'm going to put through 3 syringes. So it's already pre-populated into mammary use. If I do 1. And again, warnings and advice, your vet notes and your withdrawals then again are pre-populated. And I'm going to put in just one last treatment then for my calves. And then again, pre-populated my dosing regime. If I do, and warnings and advice, your vet notes again, and then again, then your withdrawal periods are listed. Not around the cascade, not applicable. So you have your 3 medications there then. So if there's any error, there'll be it'll show up in red here, but you can see everything has gone through there. I'm going to review my prescription. So before you put through this prescription, you have some time to review. So you have your herd identifier, your vet details, practice details, keeper details, address and animal details, and then the medications that you prescribed. And then if you're happy with all of that, then you can press submit. So your prescription has been created. And what the farmer gets then is they get a text message with this prescription ID here. So there's a 16-digit code that's going to be sent out. So this is what the farmer gets. He gets this prescription. And if there are a number of items on that prescription, each individual item then will have a separate line item ID. So that, I suppose, if they want to, if they're collecting from a licensed retailer or a pharmacist, they can choose to get different products from different pharmacists. So you can see there, with one of them we've dispensed that, and then the Terexine are not dispensed yet, so they'll get those elsewhere. And then you can, the option at the end, then you have the option then to go to prescribe again for the same herd number, or just to go back to the home page. So just one thing to touch on as well is just when I go back to the home page, actually, let's just see, can I get into it? So you have the option then on the home page is to use the system either offline or online. So when the system is online, as soon as you've prescribed that prescription will go to the NVPS, and it allows then for it to be seen. So if a farmer goes to a licensed retailer with that prescription number, that'll come up on their system. You do have the option to use the system offline. So if you're using the system offline, one way you'll know you're using it offline is there's a yellow bar just across the top of it. But if you're going to an area which you know has really poor internet coverage, you can choose to use the system offline. And that you can put through your prescription on site, so you'll still get that 16-digit code to give to the farmer, but they won't get that text message until you go offline, or until you go online again. So it's just an option. When you can set up in your manage my VMPs, you can set up as well whether you want as soon as you go online, whether you send those prescriptions automatically or whether you hold back and you can review them before submitting them. So that's the main application, then the main NVPS